Hello, I'm Paul O'Neill. I'm the Director of the East Midlands Leadership Academy and I'm here with a guest today.
Hello, my name's Shanaz Aziz and I'm a Patient Public Leadership Lead with the East Midlands Academic Health Science Network, and I work very closely with the Leadership Academy on their patient leadership.
Hi, thanks for agreeing to have this discussion today, Shanaz. Tell us a little bit about the role that you do, particularly around patient involvement and engagement, both in the AHSN and also in the kind of healthcare system more widely.
Okay, so we're really passionate about patient public involvement or patient public leadership within our organisation. So my role is twofold. It's making sure that we've got good patient public involvement across all of our projects and programmes. So we're all about innovation, and it's so critical that patients are at the heart of what we do, because otherwise innovations are designed without their involvement and there's a lot of wastage and things just don't work. So, and then the other role is the external role, which is about spreading good practice, patient public involvement and patient leadership across the whole system. So we work very closely with organisations, sustainability, transformation partnerships and other key organisations, including the Leadership Academy, on how we can spread good practice patient leadership.
Fantastic. A really great kind of initiative. We did some work together, didn't we, a year or more ago? Could you tell us a little bit about the kind of history of that? How did that come about?
Yeah, so that was both our respective organisations' commitment to good practice patient leadership. And so what we did was that we pulled our budget, and we obviously the Leadership Academy have got significant experience in terms of leadership modules. And hey, why don't we put patient leaders on that same journey? We're looking at a transformation in health and social care. So we train up quite a lot of staff on leadership, and if we're going to get the best out of patients in terms of their influencing skills, their negotiating skills, understanding the health and care landscape, we need to put patient leadership leaders on those courses too. So that joint venture was utilising the skills of the Leadership Academy, because you've got all the content, the knowledge, you've got all the expertise in terms of programmes, and we then went out and recruited patient leaders that we felt were already connected to the system and would be able to utilise that skill and knowledge.
And I think there were about 50 or so, I think, people, weren't there, went through the kind of programme?
We put through about 60, so 60 patient leaders across the East Midlands.
Yeah.
We got a good spread, all connected in some way to the system.
And I think there was a number of workshops, and it was things about how they influence, about how they present, about how they understand the complexity of the health and social care landscape, which can be really difficult to navigate sometimes. So we kind of covered quite a lot of ground in it over a few days, I think.
Absolutely. So it was run over 3 days, and then we spaced it out because there were opportunities for people to connect in between. But yeah, the modules included understanding the health and care landscape, because it is so complicated. Yeah. Communication and negotiating skills, because that is such a critical thing. Mm-hmm. How patients can bounce back. So it's really difficult when patients are trying to influence and they kind of get knocked back or they get excluded. So how do we enable patient leaders become more resilient and try different tactics to kind of influence? And then the third session was around networking and kind of influencing. So really had some fantastic scenarios where we brought in external actors to come in and role play different scenarios, and then patient leaders kind of advised on how they would perhaps communicate in a different way.
And do you think it made any difference? Do you think that programme that people went through, has it made it, what kind of difference have you seen, if any?
It absolutely did. So that first course that we put through 60 people, so we did that a couple of years ago. This year we're running another patient leadership programme, but whenever we go to events, people always comment on how beneficial it was.
Yeah.
So it really is, it does absolutely make a difference. And the benefit of that also is that we are developing a network and a pool of patient leaders that we can then offer to the system. So we've got details of those patient leaders now. And I think every programme is slightly different. So this year's is around quality and service improvement. Sure. We are actually in discussion now with the Leadership Academy about a new programme and we will offer that to new people, but also existing members, because the content of it can be slightly different. But there's definitely always an appetite for people that want to learn more. Because it just doesn't stop, does it? Your kind of journey in trying to influence the health and social care system and how to connect, it needs to be ongoing.
It's a lifetime's work, isn't
Absolutely.
it? And developing the skills to get better and better at it is equally a long-term project, isn't it? Okay, well, thanks ever so much, Shanaz, for that brief discussion. We could sit and talk for hours, but a really important kind of piece of work, which looks that we've already done, but also looking to the future. Some great kind of work ahead. So thank you.
And I'd like to thank you for actually having an interest in the patient leadership thing, because I think it is really, really critical, and to congratulate you on your 10 years.